Alberta healthcare workers say they were blindsided by a surprise move from the province, a decision to start charging most people an estimated $110 for COVID-19 vaccines this fall. The policy, announced late Friday, is meant to cut waste and contain costs. But critics say it could do the opposite, making vaccines harder to get and more people sick. Mark Villani reports.
David Silsky didn't know it when he first rolled up to his pharmacy on Monday. But the 81-year-old was shocked to learn this would be his last free COVID-19 shot.
I can't afford it. I'm trying to keep up with it, get all the shots, right? And now I got to pay, and I'm not paying nothing.
Most Albertans, including healthcare workers, will now have to pay an estimated $110 out of pocket for a COVID shot starting this fall. Those with pre-existing conditions can still get one free of charge, a decision Premier Danielle Smith defended, saying most of the shots were going unused.
54% of it was wasted, over 1 million doses. It's $135 million. And so that was very influential in saying, is there a better way for us to do it?
If we start charging for it, we're going to unfortunately drive down uptake.
But with the rampant rise of other diseases like measles in Alberta, some worry this could lead to an even more overwhelmed healthcare system.
This year alone, we lost over 300 Albertans to COVID. We had 3,000 hospitalizations. So it shows how severe this illness still is.
What we have with Danielle Smith and the UCP is a government that cares more about appeasing fringe groups. It's dangerous, and it is not driven by evidence.
The Alberta Pharmacists Association also worries about access to the vaccine. Soon, COVID shots will no longer be available at community pharmacies, only through public clinics with limited hours.
The coverage would be far less. There would be less people taking them. And I think, what I understand, they'll probably end up in emergency getting treatment if they get infected.
It might mean that seniors or other people that are high risk are going to have to travel a lot further to receive the vaccine, which would be a barrier.
And create new health concerns.
I do worry about it. It's a pretty serious illness.
And Mark joins us live. So, Mark, what are the next steps for this new policy?
Well, Ian, the province says it has ordered just under 500,000 of its COVID vaccines for this fall, and some of the estimated $49 million cost would be covered through taxpayers paying for these shots. Alberta's government added that anyone can start to signal their intent to receive this vaccine starting in August, with bookings to begin in October. Still, a decision that many healthcare workers call short-sighted for those who want to take extra steps to protect themselves. Ian.
Thank you, Mark.